entitled Challenges of Moving Research Online. And in a moment, I'm going to be passing things over to the moderator of this session, Dr. Fakhri Shafai. She's the Research and Evaluation Project Coordinator for the Autism and Intellectual Disabilities Knowledge Exchange Network, Canada. She's worked closely with numerous autism organizations and has provided educational presentations and webinars to groups throughout Canada. Dr. Fakhri Shafai, it's over to you.
Thank you so much, Dr. Goldman. Welcome to the afternoon panel session, Moving Research Online. As Dr. Goldman said, I am also the Vice Chair of the Kids Brain Health Network Policy and Research Training Committee. And today's session is really going to focus on the changes that have happened since COVID-19. We know that it's dramatically impacted most aspects of our day-to-day lives, but it has especially impacted the ability of the research community to conduct studies. When COVID-19 hit, I personally was still working on my postdoc and was had to stop in the middle of an eye tracking study in the sensory perception lab at Western. And I personally had to settle for the 30 participants that I had already collected instead of the 50 desired participants for each group. So this is not just a problem for postdocs, this is also a problem for trainees. Trainees have limited funding and timelines that they now need to adapt to completely change their experiment design to allow for remote testing in order to graduate on time. This also is impacting professors with grants, and in this session, panelists will be giving a brief overview of the research occurring in their labs and how they have managed to shift to remote data collection. Additionally, resources and best practices will be discussed to provide the audience with a greater understanding of the factors that need to be taken into consideration as they move forward with research in our post-pandemic reality. I would like to introduce, and please give a wave when I introduce you, Dr. John Paul Minda, professor at Western University. Kaylee Salagovic, a graduate student at Western University. Dr. Bobby Stojanowski, a research scientist and research professor adjunct at Western University. Dr. Kevin Sanders, the global head of neurodevelopment for Genentech. And Dr. Alonso Montoya, medical director of the Hoffman La Roche Limited. Dr. Minda, would you please start us off with your introduction?
Thanks, Fakhri. And if I have a slide available, hopefully it'll come up in a minute. Oh, there it is. Great. So let me introduce myself. I'm a cognitive psychologist, and I typically study concepts, thinking, conceptual behavior, and categorization. And before this pandemic, my lab mostly was involved with behavioral testing or basic neuroimaging. So in the photograph you see there is two of my students learning how to do FNIRS neuroimaging. On the right hand is a participant in an experiment where they're just making behavioral responses on a screen. And typically participants would come to us in our lab one at a time. And that's how I've been doing it since I was a grad student, which is a number of years ago. We've been experimenting with online data collection since 2019, before COVID, but mostly as a way to expand sample sizes. And when the university shifted to online work in March, my initial impulse was to just kind of replicate and do what I was doing, try to reproduce the same experiment setup. As the summer progressed, we started thinking, well, we should take advantage of this alternative way to collect data and to start answering new questions. So what do I mean by new questions? Well, we're running a cross-sectional study right now of cultural and linguistic differences in concept learning. This kind of research has been really common in cognitive science since the 1950s at least, but it's usually involved anthropological methods. Thanks to things like Pavlovia and Cambridge Brain Sciences and Amazon MTurk, we can do this kind of research more effectively by being able to test participants in multiple locations at the same time. So I think we're going to be collecting data online even after COVID subsides, which we know it will. I think it's going to change some of the questions that we try to ask and some of the ways that we try to answer them. That's not the only challenge. Of course, there's other challenges like keeping in contact with my team, keeping my students in the loop, keeping everyone motivated and on the same track. Those are different questions, also a challenge. They're kind of acute now, but I think they'll dissipate once we get used to things. So for now, we're happy with the way we're doing things, even though there are some new challenges, which we'll talk about later in the discussion. I'm going to hand this over now to Kaylee Salagovic, who's going to talk about her experiences in the same with some of the same challenges.
Hi, thank you. And if I can just have my slide popped up. So my name is Kaylee Salagovic, and I am a second-year master's student studying audiovisual perception in people with typical hearing and users of cochlear implants. And for the past couple of months, my lab mates and I have been pivoting our projects to online research. So the main takeaways that I want to share today are really the two main approaches to this transition that we have found to be successful for us at the level of trainees with individual projects. So a major challenge for us was that we all had projects that were in progress, but they were designed to be conducted with EEG or fMRI. And moving on to online research was really great in that it allowed us to avoid having to shelve all of the work that we had done so far, but it really does limit us to behavioral experiment designs, which has definitely required a good amount of reconceptualization and redesign of what we were doing. So we found that in some cases, there is already a variable or a task component in the existing project that can be measured behaviorally, and those can usually be transferred pretty directly to the online format. But myself and my lab mates would definitely caution you not to underestimate the amount of time and effort that really does go into reprogramming and appropriately adapting an existing task for online presentation. And then in other cases, sometimes it is better to pivot completely to a separate but conceptually related project, which is the situation I had. And I actually found inspiration for this from current events. With virtual conferences like this and Zoom classes and online socializing being pretty much the norm for right now, I started to wonder about whether people who use cochlear implants engage with this kind of content in the same way as people with typical hearing. And that actually led me to a new online compatible research question. So I would say that if you are out there looking for a new angle or a completely different question, considering how aspects of our current reality might affect populations, cognitive processes, therapies, or really any other variable that you might be interested in, I think is a great way to generate questions that do lend themselves really well to this online research platform. So I hope that gives just a bit of an overview and maybe some new ideas to any fellow trainees out there. And with that, I'll hand it over to Dr. Stojanowski.
Hello, thank you. It's really great to be on the panel today. My slide will pop up in a second. So I'm a cognitive neuroscientist interested in various factors that influence higher level cognition. So things like memory, executive functioning, cognitive control, with a particular interest in the developing mind and brain in children and adolescents. And I've been doing online based research for quite some time now. And you can see on the left side of the left panel of the figure, some of the methods we've been using. So for instance, recently we've examined various lifestyle factors like sleep habits and whether individuals have suffered a concussion, or whether those who've tried brain training programs that you found online like Lumosity affect cognition whether that be positively or negatively. And we've done this by moving away from traditional pen and paper tests that are time-consuming and laborious and require someone to be in the lab, to an online cognitive platform, which you can see in the color-coded task there. And these are tasks that have been converted to be completed online. And so the nice thing about these tests is that they can be completed anywhere, at home or anywhere where you have a device, a laptop or a tablet or a phone. They require very little in way of instruction, so they're very easy to complete, and they can be done very, very quickly, much faster than what it takes to complete a pen and paper test. And I'm actually currently in the process of developing tests that are age appropriate for children and adolescents. So they measure the same cognitive constructs, but they're much more engaging and interesting to children and adolescents. I also briefly want to talk about another way that we use online resources for doing research, and that is by taking advantage of the kindness of institutions that make large data sets freely available to researchers across the world. So I've got a couple listed there, including the Human Brain, Connectome, and Open Neuro. And we've recently been using and relying heavily on the Healthy Brain Network from the Child and Mind Institute, who are collecting various measures from 10,000 children, including cognitive measures, measures of the brain, including fMRI and EEG. They're collecting genetic data. They have physiological data like heart rate and blood pressure and BMI. So we've been very fortunate that they've made that available to us, and we take full advantage of that. As you can see, these are some results that have recently been accepted for publication. Here we compare the brain's response in children and adolescents while they watch a movie to identify differences between typically developing children and those who've been diagnosed with autism. And so the take-home message I want to make is, don't worry, online research doesn't have to be sort of the duct tape to your research program. It's not a quick fix. It's actually a great way to do science that allows you to ask questions that would be otherwise impossible in the lab setting. Just beware of pitfalls and have lots of checks. Thank you, and now I'll pass it on to Dr. Kevin Sanders.
Thank you, Bobby. So on my slide, if it comes up, I've listed 3 active programs here that we have at Roche and Genentech in the neurodevelopment space, and some of the challenges that we've faced since COVID with each of the programs. Now, in a few minutes, I can't go through all of this, but I thought it would be helpful to list some of the challenges to add to the discussion or possible questions. These are 3 very different programs, and each has had to adapt in its own way, but there's definitely some overlap. Balvaptan is an ASD study that's winding down. UBE3A is an Angelman study that's just getting started. It had its first patient in late July, early August, but the first patient in was originally planned for May. And Venture, which is a digital therapeutic using virtual reality to teach social skills and ADLs to adolescents with ASD. All of these programs have had to make significant adaptations to be able to keep moving forward. All of our internal meetings have shifted online, of course, as well as key external meetings with regulators, for example. We've had to rethink our recruitment strategies, focusing on areas or sites that are still allowed to see patients. And for those that can't bring patients to the clinic, think through ways to maintain patient safety as well as study integrity. We've had to examine our protocols to see what's possible and make protocol amendments to try to mediate things that could be adapted to online or in-home. How we collect things like rating scales or blood draws, for instance. All 3 programs were able to keep going and are still going now by working together with sites and IRBs in particular. All of this, though, has had a pretty significant impact. COVID has added months to all their timelines, but hopefully we can continue to work together to get through this and get new treatments to patients who need them. So I'll hand it now to Alonzo.
Thank you, Kevin. And if you can share my slide, please. My name is Alonso. I train in neurology psychiatry. I've been working in neuroscience, and what I try to share today is a little bit the question that maybe this is an opportunity to not just to adapt to the new environment and go online in many of our research, but also take it as an opportunity to think ahead and maybe convert this research into digital health solution for the future. I definitely moving to the digital space would represent a way to expand our research, and there is a great potential for these assessments, these digital assessments, to become biomarkers or digital health solutions, particularly in diseases where we don't know exactly the physiopathology, or there is a huge heterogeneity. If we are able to combine these digital data with phenotypic signatures, I think there is a great opportunity to advance the knowledge of these diseases. There is already some examples in where this digital way to capture data continuously can represent an opportunity to really replace traditional methods of data collection, like sleep, for instance. In the sleep disorders, there is a huge advances of that. But of course, the way to collect data digitally is a different way, a different approach to do it. But at the same time, represent an opportunity to explore areas where usually we're not able to do it. If you think in the future and you convert your research into something that eventually will become a digital tool or digital health solution, of course, we need to think about the way these tools going to be assessed or approved by regulatory authorities. The traditional way to approve in many geographies is through the classic randomized clinical trial, for instance, for drug development. And perhaps this approach is not any longer valid or has to be adapted or modified. There is a need to consider alternative ways to validate this way to collect data. Also, the collection of data, I think the potential to create these biomarkers will require the integration of many things at different levels. Integration in terms of the clinical data that you are able to capture with other validated already standard measurements. There is also another opportunity here. Remember, the digital approach is very cost effective. If you compare with the traditional way to run clinical trials, the digital capture and the digital way to do research is really cost effective. Particularly when you think about longitudinal ways to capture data. We have these, seminal examples, the Framingham trial, for instance, or the nurse health trials, longitudinal, many years, many resources, very expensive and difficult to retain individuals in the research. Rather here, we have the opportunity to really continuously capturing data and to better understand how these diseases progress, how the person with certain diseases respond. But again, I guess it will require a collective and integrated approach from different angles, different stakeholders. And yeah, that's with this, I think we go back to the four of us for the discussion. Thank you.
Thank you so much, everyone, for giving your background and introduction. We're going to jump right in with focusing on Kaylee. As a graduate student who had already designed an experiment when COVID hit, what major changes did you have to make to the design of your experiment, and what were the technical considerations, especially around hearing issues? And what resources were you able to draw upon?
Yeah, so it's actually been an interesting learning experience, definitely, to rethink how to best measure the variables that we were interested in with the knowledge of some of the limitations of online research. And I think that's really what drove the major conceptual and technical changes for my project in any case. For perception researchers specifically, I think we're really used to being able to control absolutely everything about our stimuli, from sort of the decibel level to millisecond presentations, things like that. But obviously with online research, we don't have any control over what size monitor somebody is using, how fast their internet is, how loud they have their volume set, any of that. So with these sorts of limitations, for my project, one of the things we ran into is that we can't measure absolute perceptual cutoffs or thresholds in the same way that we would in the lab. So the solution that we came to was instead to measure each participant's sort of range of these values on each variable. And by doing that, it still allows us to compare the overall size and other characteristics of individuals' ranges between individuals and between groups and things like that. So it was sort of just a conceptually different way to think about the exact same variables and a different practical approach to measuring them. But as for resources and support, huge shout out to my advisors, as well as I'm just very grateful that our lab has been taking this as very much a team project. So it's been really invaluable to just have sort of some shared knowledge and be able to go to each other to work through and troubleshoot these problems. So I would definitely recommend, if you can have a buddy for this process, that is great. Also, more specifically, we're all using PsychoPy and Pavlovia as our platforms to do that. And the team at PsychoPy has been hosting really great virtual workshops that I would definitely recommend as well.
Wonderful, thank you so much. Moving on to Dr. Minda and Dr. Stojanowski, what sort of technical issues or details did you have to take under consideration while designing your experiments for online use? And are there any concerns about the validity of the test paradigm and the reliability of the data?
Sure.
Let's start with Dr. Minda.
Yeah, I wasn't sure which one of us would go first, but I guess I'm talking now, so I'll go first. So some of the challenges we've had, the main one, and I think this is probably true for a lot of people who are doing, and Kaylee mentioned this too, doing psychophysical research, is what I would call the dual task paradigm. So in cognitive psychology, a dual task paradigm is where you're asking your participants to do something else, which causes them to divide their attention, which can reduce performance on the task you're really interested in. And we can reduce that in the lab by asking participants to come in and do our experiment, which is typically making responses or reaction time responses in a controlled environment. So they're using our computer in one room, one at a time, under the same circumstances. When they're doing it online, we don't know where they're doing it, right? I mean, they could be doing it in their bedroom. They could be doing it while they're doing 3 other tasks. They're probably doing it while they're watching TikToks on the other, on their phone or something. I have no idea. That's part of the problem, is that we sort of don't have control over that aspect. Now, we can make up for that by trying to design tasks which are maybe not susceptible to dual task interference. Also by trying to expand our sample size. Also by trying to encourage, short tasks for which you'd be less likely to drift off and do something else. But that said, that's also a problem in in-lab experiments. So people who are collecting behavioral data in the lab, including my lab, have generally noticed that our participants will multitask while they're supposed to be not multitasking. So it's not unique to online. It's just that we can't see it happening as easily. So you also try to deal with that by introducing individual trials, which can be attention checks. So questions that would, we're not using as part of our measure or using as part of our dependent variable or something like that, but would check whether or not someone's paying attention. So there are ways around it, and those are some of the things that we're learning about. The other one, and then I'll hand it over to Bobby, is just knowing what platform they're using. So Kaylee mentioned that a lot of these things are being done with a platform called Pavlovia, which is built off of a platform called PsychoPy. We'd been using PsychoPy and Python in my lab to design computer-based experiments for a while. Pavlovia is just a way to take those Python scripts and convert them to JavaScript so that they run on a browser, which can also be in a mobile device. But you don't always know exactly how it's going to look on someone else's device. So you really do need to test them in slightly different ways than you would if you were running them in the lab. So those are technical challenges, but they're not outside. I guess I wouldn't say they're outside of the realm of what we would expect to, a challenge we would expect in the lab anyway. I mean, we have to test things the same way if we're doing it in the lab. It's just that you don't have as much of a hands-on interaction with it. So I don't know, Bobby, you've probably you've done a lot more with the online stuff with Cambridge Brain Sciences. So there's probably a different perspective from that.
Yeah, so I think a lot of the important sort of technical challenges were covered by Kaylee and Paul. And of course, are really clever solutions to dealing with these things. Some of the things to touch upon other areas. So data storage and data management becomes an issue. So when you move online, one of the luxuries of moving online is that you get way more data. And so this introduces issues with or challenges with data storage and data management and privacy. So I think that's something that you have to be careful about. I think another major challenge is the trustworthiness of the data, and this is a problem particularly in development and in conducting developmental studies. So if we have a study that we want to evaluate cognition in children between ages 5 and 10. We want to make sure that the data coming in is from children aged 5 to 10 and not from a nearby parent. And so there's obviously ways to control this in the laboratory. We can watch the adult in the room to make sure they're not responding. But there are a number of checks, and I think this will be a theme throughout today's conversation, is ensuring that you have checks in your data. So things I look at is, when was the data collected? So if participants are completing the study at 3:45 a.m., it's probably not a child. We look at, we have a number of questions that we introduce in a questionnaire that we can validate at different time points to make sure there's consistent responding. And a really nice thing is if you have some in-lab data that you can use to cross-validate. So if you're getting a bunch of data where participants are performing 10 times faster or 10 times better than what you would expect for a certain age range, then you can also begin to question the validity and the trustworthiness of that data as well. So I think those are some of the areas that we've experienced in working with online studies.
Great, thank you so much. We're going to shift the focus a little bit to the research that's happening in industry. What were the barriers to adoption of online testing as opposed to in-person testing? And what barriers are there for industrial approval by groups like Health Canada? We'll start with Dr. Montoya on that one.
Sure. So I think there are of course barriers. I would say there are external and internal barriers, if you can subdivide it in that way. External barriers are related to the environment, to the system employed. There is some research suggesting that people that may be or not familiar with the online platforms or environment, depending on the speed of the internet you have, depending on the platform that you're using, as it was mentioned. Those are the external kind of barriers that sometimes we face. Internal barriers refers more to the person, to the perception or the attitude toward these kind of assessments. Some people may prefer still the face-to-face interaction with the researchers or the clinicians. In our work, we've been noticing that sometimes you have to adjust and adapt depending on the preference of the individual participant in the research. So those I would say are the major groups or barriers. In terms of regulatory, of course, as I mentioned in my prior intervention, I think the world is getting used to the new data. Just to give an example, in my work, we work in neuroscience. We have different pillars. We have neurodevelopmental disorder, but we have neurodegeneration, we have neuroimmunology, rare diseases, and virtually every single program now, nobody designed within my organization a trial without any digital or online sort of assessment. Is embedded now in the research, perhaps looking at the future. And I think the pandemic just forced that movement towards that. But I think the regulatory bodies are a little bit behind because they really rely on the academia, rely on the researchers, rely on the companies like the one I'm working with to generate data and to make meaningful data and explain them what that means. Once we have that, I think probably it's going to be different, but so far, at minimum, they will consider the same pathway as any other research. So it's very, very tough, difficult. It was mentioned that we capture a lot of signals that we don't know exactly what they mean. So for them, it's very hard to do it. But nevertheless, they are working very hard. Health Canada particularly, they are really advancing and adapting the way they are trying to evaluate and assess and approve the different digital or online assessments.
Thank you. Dr. Sanders, do you have thoughts on that?
Sure, I can add a little bit. One of the bigger challenges that we face with our medication trials are things like physical exams, labs that have to be drawn, EEGs, EKGs, for instance. And we've tried to switch those over to like in-home nursing when possible. So we've tried to be as creative as possible. As Alonso mentioned, we've tried to start writing our protocols and started writing our protocols with online backups if needed.
Live broadcast, I think we're getting some interference from you. Sorry, Kevin, can you?
I'll keep going. I was just making sure I wasn't supposed to be doing something else.
No, you're fine.
No, so the big question is, are these scales the same that are done online versus, in person? And, I think as a couple of the other speakers have mentioned, trying to parse that out once you start getting the results. But a lot of our trials already have started switching to centralized raters for other reasons, just to have standardized approaches. But for the most part, we want to try to collect data in any way we can. It's better than not having any data at all, I think is our opinion, especially at the key time points that we need them in our studies. So.
Thank you very much. So we've really been focusing a lot on the challenges and obstacles to conducting research in an online environment. But now I'd like us to switch to looking at research opportunities that have been created by the pandemic. So were there any unexpected benefits in being forced to move online? And if so, what were they? First, we'll start with Dr. Minda on that question. You're muted.
Still muted?
I think you're still muted, Dr. Minda.
I'm not muted on my end.
Now we hear you. Thank you.
Okay. Maybe it just took a while to unmute. I don't know exactly how much I said.
We didn't hear a
before.
thing.
Okay, well, great. I started giving the wrong answer. So let me give the right answer, which is there have been a few unexpected benefits. So one benefit, which I kind of hinted at in my introductory discussion, was that we decided to take on a sort of a cross-sectional cultural and linguistic study. So this is something we had been talking about for a while. It's something that's been common in cognitive science for a long time. So this idea that, for example, you've probably heard the acronym WEIRD populations, Western, educated, industrialized, rich, democratic nations tend to make up the bulk of participants in social and cognitive psychology research. And it turns out there was a call for papers for basic cognitive processes, looking at, perhaps maybe trying to see if some of the core findings in cognitive science expand beyond those WEIRD populations. This was in the journal Memory and Cognition, and that just came out sort of at the end of the summer. And we had been sort of planning a study that turns out it lined up really well with what they were looking for. So we've started doing that data collection now, and this will involve 2 of my graduate students. It's a study we wouldn't have otherwise done, or we would have done it a different way, or maybe we wouldn't have felt as much like it was the main thing we were going to be working on, because we'd be focused on other things. So that was an unexpected benefit. The fact that this opportunity would arise was great. The fact that we could take some tasks that we've used in our lab a lot of different times to explore the different ways in which people learn new concepts, but then maybe ask if people in other cultures who speak different languages would learn them in the same way. Again, it's a question that's come up repeatedly in cognitive science, and there's no real clear answer. And this will be one way to answer it in a slightly different way. So we'll collect the data simultaneously from lots of different participants. There'll be challenges, of course, because we have to assume that, everybody has access to, has web access, which most people will. We want to make sure these short experiments will be able to be delivered online on a mobile device, because that might be the main pipeline to the internet where we want to test. We need to be able to translate things into lots of different languages so that the instructions will be in the participant's native language. Fortunately, at Western, we have, and at Brain and Mind, Kaylee and Bobby can, and you, Fakhri, can sort of corroborate. We have a lot of different people who speak a lot of different languages, and that has worked out really well. So that's been an unexpected benefit. And the other one that I think, and this one isn't really a benefit yet, but I think it might be in the long run, and that is the possibility of some of the stuff that we do being able to be reproduced in a more direct way. So by that, I mean, if somebody wanted to reproduce one of the experiments that I've run in the lab in the past, they'd have to read what I wrote and hope that they interpreted it right, hope that everything was done in the right way, set it up on the device, make sure it works. We can provide them with scripts and stimuli, but it's still, there's still that sort of individual touch where people might be coming into a slightly different lab at a different time. If somebody wanted to reproduce or extend the data for an online study, they could do it almost in the same way. So they could take our script, they could take our stimuli, and collect data on MTurk or Prolific or any other sort of online platform, and reproduce almost exactly the same study with the same caveats, which is we don't know whether people are doing it in their bedroom or in the car or whatever. But it would sort of remove some of that individual control that an individual research assistant or grad student or professor would have over the data collection. I don't know that that's actually been a benefit yet, because it's probably a little bit too new in this, but I can see that being beneficial later on. If somebody wanted to look at a study we've done a year from now, they could literally run exactly the same study online. And that would allow it to sort of, to determine whether or not the stability is there. So that might be another unexpected benefit that, we'll see.
Thank you.
So that's what we've got on our side.
Dr. Stojanowski, what are some of the unexpected benefits in your research?
I think in general terms, there are a number of benefits, as you've heard. So you're asking questions that you perhaps wouldn't have asked if you weren't forced to go online, or you're reconceptualizing or rethinking about how to best answer questions that you've already been interested in. And I think most of us have experienced that in some form. Another major advantage is that is the availability of the data. You just get way more data than you would in a lab setting. And so this allows you to think about the scientific questions you're interested in a completely different way. In lab contexts, you're really confined by a number of different resources. And you just can't get that many people to come into a lab to complete your cognitive study or whatever it is you're interested in. So you get huge amounts of data. And for me, what's happened is it's created sort of a symbiotic relationship with online versus in-lab studies. So I'll conduct a number of online studies. My first online study, I got 16,000 responses in one night. So I get this rich data set, and I can start to now mine that data, do data-driven analyses. And the nice thing with that is that new hypotheses emerge. You start finding patterns in the data that you didn't expect or you weren't even looking for. Mm-hmm. And this creates new hypotheses that once this pandemic is over, we can go back into the lab, we can start testing those hypotheses that we've created from the large data sets that we never would have thought about in the first place. I think another advantage with using these large repositories of data from the different resources that I mentioned earlier and that Paul touched on is replication can move to the forefront. Mm-hmm. That acquisition protocols are now standard and the same for everybody. So if I run a study using 300 fMRI data sets from the Child and Mind Institute, and I publish that result, I hope that other researchers and labs will replicate that finding using the exact same data. So I think that's a really huge positive. And there's a whole bunch of other stuff that goes along with it. It's really, really expensive to run a study in a lab. It becomes way more expensive if you're doing any type of neuroimaging. So these large repositories, take care of all of that and allow other researchers to share that data.
You definitely touched on one of our audience questions that Jesse Lewis asked, are participants any more or less willing to participate in online research? And based off of the number of responses that you had overnight for a study, I'm going to assume that they're more willing to participate in online research. Kaylee, have you found that's the case with regards to people being willing to participate in your studies versus coming into the lab when you were designing?
So I would say my case is slightly different in that I shifted to working with the cochlear implant population, specifically with this shift to online research. That had always been a bit more of a long-term goal for me. But the upshot was definitely that, when you're bringing people into a lab, there's, statistically speaking, only so many people within however many miles of your lab who have cochlear implants. That's sort of the nature of a special population. So the big upshot for me was then being able to create this, get in touch and collaborate with other researchers who do cochlear implant research, and basically send the project that I was hoping people would do out to them instead of having to have people come into us. So I haven't had the experience of putting a project up on a platform like MTurks or anything like that, because I am specifically sending it to certain people. But I think that's like a flip side benefit of the online research platforms as well.
Thank you. Looking at this from a medical research side, what is the potential for remote testing to expand access to testing? For instance, how might remote testing help with research on individuals with rare diseases? We'll start with Dr. Montoya on that one.
Sure. I think particularly if you're able to move your online research to mobile wearables, I think it opens the door to different things with rare diseases. One is just the nature of rare diseases. It affects significantly more in kids and adolescents, and you probably will get more engagement instead of asking them to come to these long hours of first of all waiting for to see the visit, and then long hours for occupational, for cognitive assessment, for whatever. You may have a positive effect with that. Rare diseases by nature are fewer individuals in. Not all of them lives in great cities and with access to clinics, hospitals, academic centers. So being able to remotely offer those individuals assessments, it's a fantastic opportunity in my opinion. But also for the physicians, for the researchers, particularly in situations like Canada. Canada is a perfect example for that. I think huge geography with a lot of population in urban areas is an opportunity to reach those individuals remotely. So I think it's just opening a different window for expand our research, particularly with this population. The pandemic, I think, affect most importantly to people with rare disease in that way. Many of the centers are closed or are far, the mobility, etc. So in my opinion, it's a great opportunity also for expand the research in that area.
Dr. Sanders, would you agree with that with regards to the prescription drug testing?
Yeah, I definitely agree with what Alonso had to say, and especially the digital biomarker part. I mean, we feel like that has huge potential. I mean, we're not quite there as a field yet, but we feel like that has a lot, especially remotely, that can passively tell us better how our patients are doing than what we can do now. We've started looking more at scales that could be done online, and we're helping to develop scales that can be done online. So yeah.
Wonderful, thank you. We're going to shift into the audience question and answer period now. And we have a question, another one from Jesse Lewis. That's a great question. Are there any unique barriers in obtaining ethical approval in order to move online? We'll open that to the floor.
I'll
just pick. Okay, thank you.
Yeah, there are. So when you, and this goes back to the issue of data management and data storage. So when data is collected in the lab, you have full control of all the information that's being collected. This is often in an Excel sheet or even in a printout that you can store in a local machine, and you basically cut the internet out. Whereas when you move your studies online, all of this data is being transferred online. And if you're using a third party like MTurk or Pavlovia or Cambridge Brain Sciences, that data is being stored on a server, often an Amazon server. And so there are issues with what the nature of the data that's being collected. You never want any of the data to be identifiable so that that data gets traced back to an individual. I think Kevin and Alonso can speak to, and I think this is magnified in clinical settings. So I think when you collect data online, you just have to be really careful and extra aware of the fact that sensitive information is being passed across servers in the world.
Dr. Sanders, how have you guys dealt with this issue?
Yeah, I mean, again, I think it's a lot what Bobby was talking about. But for instance, like, even when we use things like digital biomarkers now, the information that is collected on the device has to stay on the device. So we can only transfer data that's already de-identified online. So there are very strict rules that we have to comply to as far as patient data. Mm-hmm. Yeah.
Alonso,
I just want to.
Oh, sorry. Yes.
Oh, sorry. No, go ahead, Alonso.
No, I'm completely agree. I think privacy and confidentiality, it makes even more importance here. as for the factors they've been explained. But I think Canada is any jurisdiction has, doing a job trying to catch up with that and trying to implement proper measurements. And every researcher here, every small company, every big corporation needs to align with those regulations and keep that. The problem is even larger when you are trying to do big data kind of approach, collecting data from different organizations, hospital sites. It has to be something to control that. Luckily, there are some approaches now that we are trying to understand better, like the federated system where everybody is owner of the data and you plug only non-confidential information to make your research and so on. But it's still, I think, there is a risk there, and we have to be very careful about to follow the recommendation or regulations.
Thank you. Dr. Minda?
Yeah, I was just going to add to that, and this is for anyone in the audience who's working specifically at an academic institution or university. So I'm a member of the Research Ethics Board at Western for non-medical research. And this is a question that most of us have been sort of building responses to. Online research was possible prior to COVID, but as it increased, the number of questions that come up. So I would suggest that you work really closely with your Research Ethics Board, whether you have a research officer or if you know someone who's on a Research Ethics Board, and just ask what protocols they're starting to work on. So wherever you collect your data, it has to have some sort of technology risk assessment done so that the university can ensure that it can stand behind the integrity of the data. So if you're collecting data on an online platform, as Bobby mentioned, you're going to be storing it somewhere else. And that's important for the university's perspective because it means that they don't have control over it. So if they're going to provide approval for the research to be done, they need to ensure that that data is secure. So the best advice is to reach out to a research ethics officer or a research board member and ask what they've been doing so far, because most of us on that side of things have been developing strategies to deal with this as we go. So things have, there's new stuff now that wasn't available, or new ideas or new protocols or new strategies for dealing with it that probably weren't on the scene a year ago.
That's great advice. Thank you. We have a question from Dr. Jennifer Zwicker. What approaches did you use to connect with your research teams remotely to try and recreate the lab and team environment? I know the isolation piece has been rough for a lot of us. So how have you tried to incorporate that team environment in this new reality? We'll start with Dr. Stojanowski.
Yeah, that's a great question. I think what I've been doing is continuing to meet with my team regularly. The nature of those meetings have changed over the course of the pandemic. Early on, it was a lot of discussions about the pandemic and how everyone is dealing. I tried my best to make sure that everyone in my group had everything they needed for conducting research, but also in non-research ways as well. We would and I made myself much more available, so trainees could reach out at any point and talk about whatever they wanted to talk about. And so I guess I tried to make our meetings have a really sort of entertainment fun component, or as fun as it can be over Zoom, while also ensuring that we're talking about science and different projects and everyone is making progress in one way or another.
Great, thank you. We only have a couple minutes left, so I'm going to ask one more question of each of you. With hindsight being 2020, if you could go back and give yourself one piece of advice at the beginning of the pandemic for conducting research, what would it be in one sentence? Let's start with Kaylee.
On the spot. I think my advice would just be to start as early as possible. Of course, oh, this is already more than one sentence, but of course, there was a lot of kind of rethinking and redesigning, but I do wish that at the same time as I had been doing that, I had been digging into the psychopy and Pavlovia stuff just to get that going.
Great. Dr. Minda?
Yeah, I would have written a book proposal on how to move your research online, because all the stuff that I've learned would have been terrific, I think, to put down in one place. And I'm sort of half joking, but I'm actually sort of not half joking. I think that would have been really something to, if I would have known back then, because we started working and thinking about moving online even before COVID was a thing. But if I would have known, I would have probably thought about making it more systematic. And that would have, maybe resulted in a book, but maybe would have resulted in at least a sort of a coherent set of practices that I would have worked out before we were sort of faced with the reality of doing everything online.
Great, thank you. Dr. Sanders, you're muted.
So I think it would have to be one of the questions that we'd already discussed. And I think it would be, stay connected and just understand how important it is to check in on a frequent and regular basis with the people that you're working with.
Thank you. Dr. Stojanowski?
I think the message I want to convey is think about online research. Don't think about it as sort of a necessary quick fix to your research program. Think about it as an opportunity to really expand your research program, because I think there's a lot of opportunity to do really good science online.
Thank you. And Dr. Montoya?
I would follow the last comment. Look at it as an opportunity to really explore different things. And personally, I was trying to lead a community of digital biomarkers, and the pandemic just came, and I didn't did a baseline with that research, so I missed that.
Yeah.
But anyway.
Well, thank you so much to all of our panel members. I appreciate your time and you sharing your expertise. And now I would like to hand it back over to Dr. Goldman.